Hello, everyone, and welcome to HeadWise, the videocast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I am the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. I am honored today to tell you that I am here with Dr. Dawn Buse. Hi, Dr. Buse. Thank you again for being here. How are you?
Hi, Dr. Weitzel. Happy to be here, and hi to everyone who's joining us today.
Dr. Buse is a repeat guest that we all love. She is a clinical professor of neurology and a psychologist who specializes in headache. She's super well known in our community. And we are having a very special episode today because Dr. Buse recently was awarded the Women's Health Science Award from the American Headache Society. She has participated in many studies of women with migraine, as well as caring for women with migraine as a headache expert psychologist. I also recently learned that Dr. Buse is the most published female in headache medicine, which is really exciting. So welcome to you, Dr. Buse, and congratulations on your award. When you receive this award, you are asked to give a presentation. And you get to choose the topic, and you also get to choose the title of your presentation. The talk you gave was called Caring for Women with Migraine Benefits Everyone. I was lucky enough to be in the audience when you gave this talk, and the entire auditorium was deeply moved. And I truly felt that our audience on HeadWise deserved the chance to hear what was said in this presentation. So I want to thank you for coming and giving everyone the chance to hear this. And that's what we're going to talk about today. So let's just start, Dr. Buse. Can you explain to us, to our audience, just how disabling migraine can be for women, but also for, everyone, not just women?
Well, I'm guessing our audience probably knows, but migraine can impact all aspects of life negatively, from the smallest daily decision, taking care of your kids, driving them to school, getting into work on time, to big life choices, whether you're going to have children, getting married, getting divorced, going to graduate school, accepting certain careers, opportunities, everything in between, work, school, family, personal, leisure, everything big and small, everything that does matter, everything that seems little. And in fact, the World Health Organization has, in fact, in their recent global burden of disease study, found that migraine is the second most prevalent disabling disease globally on the whole planet. And it's actually first for women aged 15 to 49. So we have the stamp of approval from the World Health Organization that yes, migraine is truly disabling. And in fact, I know you've had my colleague Richard Lipton on before. Dr. Lipton will tell you of a time 30 years ago, 20 years ago, when people did not consider migraine disabling. They thought a disability was something visual. Someone was impaired, they couldn't walk, they couldn't move. That was a disability. And there was a real fight that people had to do. Researchers, doctors, and patient advocates, and scientific organizations like the National Headache Society, National Headache Foundation, American Headache Society, the American Migraine Foundation, all really had to make their best efforts to indeed show how disabling migraine can be. But I think our viewers already know.
Right. So I'd like everyone to understand what you mean. I want to give you a chance to tell them what you mean by the title of this talk that you gave for this award talk. Caring for Women with Migraine Benefits Everyone. What does that mean to you?
Well, I think that we know that women play really integral roles in the fabric of society. And this is not to downplay the important roles that men play. I just want to focus on women for a moment. And we know when it comes to families, communities, workplaces, women are really right there in the fabric. And when you take a woman out of the equation, let's take her out of the equation for 4 hours, for an afternoon because she has migraine, or for 3 whole days because she's had a longer attack. Everything kind of falls apart around her. It's like you throw a rock into a pond and there are these ripples. It affects her children. It affects her spouse or partner if she has one, or maybe extended family, or maybe seniors she's caring for, maybe a sick family member. It also impairs workplaces. It impairs all the jobs that women do. Women provide a lot of caretaking roles in their careers and professions as well. They are often teachers, they are doctors and nurses and healthcare professionals, they are counselors, they are support people. They do all sorts of administrative work and all sorts of work like being pilots and flight attendants and so much of kind of the things that keep society running.
Hmm.
So when you pull a woman out of that, it leaves a hole
Yeah.
that other people try to fill, but it's not easy to fill the shoes of a woman. And so when I'm saying that caring for a woman with migraine, getting her optimized therapy that maybe avoids attacks altogether and avoids that disability happening altogether, or at least at the same extent, helps everyone. Those ripples help workplaces, communities, family, societies. It helps everybody.
I I don't get emotional on the podcast very often, but this talk, not only did it make me emotional then, but it gets me emotional to just even get started talking about it. I sitting here trying to work, and I have a 10-year-old son with chronic daily migraine upstairs because he can't go to school. And it's true, if you take us out of the equation at all, it's not just us, it's our kids that may also have migraine that aren't being taken care of. It's very difficult. So thank you so much for communicating this to the audience today. I think this is great. I think everyone's going to love it. So throughout your career, you've been involved in so many migraine studies. We've reported a lot of them here on HeadWise. You shared data in your recent award talk from several of these studies that gather data on the impact and burden of migraine, including the Cameo study, the Overcome study, and the one you just mentioned, which is MyCOAS. I know that you also talk with patients in your role as a psychologist. What are some of the areas that women experience the negative impacts of migraine? Really, I know you went over them specifically, but do you have any right off the top of your head that are going to really stamp an impact on our audience right now?
Well, I think there's some big buckets. So let's talk about family life. And that may
Mhm.
start way back with dating and relationships, establishing a marriage, establishing a family, having children, raising children, and also maybe caring for an aging parent or a sick family member, extended family, household pets, kind of keeping the household running. All of that is something that can
Mhm.
be greatly impacted by migraine.
Right.
Um, and if a woman is maybe doing all that without support of a partner or extended family, that's really even maybe tougher. So that's something to think about. So that's kind of the family life realm. There's the work and the school and the financial realm. So younger, it might be school. And it's such an important time of development. Migraine starts in adolescence for a lot of people, a time when not only do you need to be learning at school, but you need to have the social development, the time with the peers, the kind of enjoyable, but also some of those awkward experiences. Those are all part of growing up, developing,
Right.
becoming who you are. And so those are important times. And those times can be very impacted by migraine and missing out. So academically, socially, developmentally. And then someone can go into career decisions, um, and that can be greatly impacted by migraine. People might make choices based on having migraine, like maybe I shouldn't go on for an advanced degree, maybe I shouldn't take a more demanding role or a travel role or a role with variable schedules or a role that's not flexible. And so migraine may limit people's choices, and then we know that some percentage of people with migraine, often the most frequent, severe, and non-responsive to treatment types of disease experience that people have, may not be working at all. They may be
Right.
occupationally disabled. They may have they may be temporarily or permanently out of the workforce. And we've talked about this before together, you and I. That's something that's not taken lightly by anyone. Not only does it have major financial repercussions, but it has major kind of identity and purpose and passion repercussions as well. So those are just some of the ways that we hear women talk about impacts of migraine. And I'm going to leave one more bucket of the enjoyable things in life:
Yeah.
vacations, holidays, fun, loud, bright movies, bright beaches, loud parties, concerts, time with children. We do hear people talking about planning for a vacation all year. And then when the vacation comes, they're hit with a migraine attack and they spend half of the vacation in their hotel room while the rest of the folks are out doing whatever. So also that enjoyable social hobbies, leisure part of life.
Right. So let's trace back a bit and go into some more detail on this data and your experience. And I wanted to start with the impact that these people that you spoke with felt that or these women particularly that you spoke with felt that migraine had on their education and career, especially if they had chronic migraine. What did you find in your research that you can pinpoint for us today on this topic?
All of these studies where people have a voice to share their experience of life with migraine, we consistently hear that school was disrupted, achieving college advanced degrees, if that's something that was in their path, was disrupted, that it can be difficult to be consistent at a job. Sometimes they
Right.
get labeled as being unreliable, especially if there's
Hmm.
not a lot of flexibility. Um, and that flexibility often doesn't happen in a lot of jobs. A lot of jobs, people need to be there at certain hours. There may
Hmm.
not be flexibility in when they can come in, when they can leave, if they can take a little downtime in the day. So there are all sorts of jobs that just may not work well for people with migraine due to
Yeah.
these various reasons, due to the occupational environment, what's around them, all sorts of things, whether someone's willing to make accommodations or not. So we really hear about migraine limiting people academically, in the workplace. We hear a lot about guilt and embarrassment and the struggle that happens with both bosses and coworkers. Sometimes with people not being accepting the person with migraine, not being able to participate or to stay or getting something done on time, that can
Hmm.
really be a struggle and can lead
Right.
to negative feelings. It can lead to poor performance reviews. Now, hopefully, as you and I always advocate, the person with migraine has rights. It is protected in the American with Disabilities Act that you should have accommodations. So please always remember that if you're getting faced with these kinds of challenges, you're getting not getting accommodations or you're having repercussions. But let's say colleagues. Colleagues are a different boat. That's more just that someone's giving you a hard time, or maybe they don't even say anything, but you feel that resentment or you
Yeah.
feel the negative experience. And then people ultimately, their finances are certainly impacted, which makes everything in life harder because
Hmm.
you need your income to support yourself and your family and whoever you have to support. So all of those, everything can be impacted negatively by life with migraine.
Okay, well, let's move on to what these women said about the impact on their relationships and their families. I find that one particularly difficult. What did they say there?
Well, this is an emotional topic. You're a mom, I'm a mom. We
Yeah,
can imagine how it feels to not be parenting the way that we would like to, or that
right.
we think we should, or we think that's ideal. A really large percentage of parents feel very guilty that they're not being a good enough parent. They could be a better parent. And then it's due to migraine. And those rates increase with more monthly headache days. So
Hmm.
from the lowest frequency to the moderate frequency episodic migraine to high frequency episodic migraine to chronic migraine, we see 70 or 80% of respondents saying, I'm not the parent I want to be
Oh,
because of
wow.
migraine.
Okay,
We see guilt,
right.
shame, embarrassment, depression, anxiety, all of the above around parenting, missing out, feeling that they're just not there for their children the way they'd like to be. Um, we also see that extend to feelings with partners or spouses or other extended family, feeling that you're letting people down, that other people have to step in and help or fill the role, or that relationships kind of get permanently imbalanced. More of a caregiver,
Right.
caretaker role, or always that this person's always stepping in and this person's not doing enough. And those imbalances can lead to a lot of negative feelings in relationships. So, those are all commonly reported experiences.
Okay. Well, to get even more specific, This one is actually very difficult for me because I have a child with chronic migraine. He actually has daily migraine, and I also have an adolescent. So that's why this one's difficult. You were involved in something called the Cameo Family Burden Study, where you sent separate surveys to adolescent age children and also partners or spouses of people with migraine, as long as everyone consented and agreed. What are some of the ways that adolescents felt that their parents' migraine impacted them?
Well, this is hard for parents to hear, but
Yeah.
the rate of depression and anxiety were higher among those adolescents with parents with migraine, and that's from a couple different studies, and that always makes us feel guiltier. In the Cameo study, adolescents did mention things like with a parent with migraine that they would need to be quiet at home. Maybe they couldn't
Mm.
have friends over. They would miss some school due to their parents' migraine because the parent maybe
Oh
couldn't
God.
get them to school. They'd be late to school, maybe not having homework done or projects done, or being able to participate in extracurricular after school activities to the same extent, or sports, because of other because their parent might have a harder time driving and picking them up or being there for them. So all sorts of kind of range of things the adolescent would like to do or needs to do being impacted, as well as emotionally struggling with feeling worried for their parent, and in some cases feeling sad that their parents not kind of physically and emotionally there with them at times that they want them there.
Yes, I have seen that in both my kids. Luckily I feel like they're getting to play. I'm getting them to places, but I've definitely seen the emotional impact of me not feeling well. And so that is definitely a thing, and it's sad, and I'm kind of tearing up as you talk. So I'm so glad we're addressing this. I'm sure there's people in our audience that are feeling that. And I think that it's so great that this day and age we talk about it, because when I was younger, no one talked about these things, and I had a father with chronic migraines. So how did the partners or spouses of these women say that their lives were affected?
So partners and spouses talked about needing to make shifts in their schedule to kind of pitch in, and how
Right.
that might affect them in their own jobs, their
Mm-hmm.
own finances, their worry about covering the finances for the family financially, and decisions they would make in the workplace. Like, could they take a traveling job? Could they take a job with more time commitment or certain
Right.
hours or greater stress or greater flexibility? So partners or spouses did talk about that it affected them in the workplace, as well as affecting them emotionally, that they feel
Mm-hmm.
worried for their partner or spouse, they feel sad. And then generally there's just kind of missing out. And we all know that with migraine, you do miss out on all sorts of moments and events and activities. And partners felt sad about that.
Mm-hmm.
They also would sometimes feel this imbalance in the relationship where it started to be like more of a caregiver, caretaker than more of an equal relationship. But
Right.
something that's really important to say is that we also surveyed the people with migraine. And the people with migraine actually estimated the impact to be higher,
Right.
greater, worse than it was when the teenager or the partner reported. So making me think that the person with migraine is living with more guilt, worry, and anxiety than the family members are actually feeling.
Yeah.
And, as a reminder, children are resilient. Children grow up in all sorts of hardships globally and over the centuries, and get through it and survive. And it often makes them more kind and compassionate and caring individuals. So I
Right.
know as mothers we beat ourselves up, or as parents in general, but that's something to remember, that children are resilient, and that there are some things we can do to ease the burden on the family members.
Mm-hmm.
And you and I have talked about that before. I think we have
Yeah.
a whole podcast topic on how to kind of ease the burden, having backup
Right.
plans and other things that you can do.
Taking
Giving
care of our
giving
caretakers.
Yes, exactly.
Yeah.
Giving them very specific ways that they can help, even if it's young children, giving them a way you can help. If you could bring mommy a cold washcloth right now and whisper really quietly a story, that would make mommy feel better. Well, hopefully it makes you feel better, but even if it doesn't, now you've given this child a sense of here's something I can do to help mom. It's making
Exactly.
the child feel better, feel less worried. If your child's feeling better and less worried, you're going to feel less guilty. So
Mhm.
there are things that you can do both in parenting as well as in partner relationships to try to keep them more on an even keel. And I
Right.
like what you said, caring for our caregiver. So always
Right.
trying to remember too, maybe when people are feeling a little bit better about giving some extra attention and gratitude and
Right.
time to the caregiver, to the partner.
Right. My son used he when from the time he was very little, he had it sounds so silly. He had a dragon made of Legos that he was sure had migraine. And he would wrap it in a blanket and bring it to me. And he thought it was good luck when you had a migraine. And I don't know why it made him feel better. So that even little kids can do little things that make them feel better. So I think that's a
Everybody
great
wants
point.
to help. I think it makes
Right.
them better when you kind of accept, as the person with migraine, if you accept the help, it makes people feel better.
Right.
Yeah.
So moving on to stigma, which is just such an important topic. You and your colleagues have been studying migraine-related stigma as well. And you published a study where some of the data was collected in New York City headache clinics, as well as the Overcome study, which was just published in Neurology, to my understanding, this week, I think. Is that correct? This week when we're recording, probably not the week that it's
Right.
actually being released, but it was very recent. Believe us on that. Can you tell us a little bit about the implications of stigma for people with migraine? Because, and don't let your eyes glaze over, because it's so much more than what people think. This is actually impacting our health. So
Really is.
I love this data. Go ahead.
Right. Okay. So stigma is, there's a bunch of versions. One type is a self stigma. That's where you
Right.
think, I'm really not worthy. You feel guilty, you feel embarrassed, you feel ashamed of your own self and your own actions due to having migraine. And lots of people will feel that. It's pretty common. And so when you have to cancel attending an event, or you can't fulfill a responsibility at work, or you don't parent the way you want to, you feel personally ashamed and guilty about that because you have migraine. That's a self stigma. There's also an external stigma. It's how others view people with a certain disease or condition. And so that would be people in the general society saying, oh, people with migraine, they're faking it, they're lazy,
Mm-hmm.
they're using it to get out of work. It's kind of an external stigma. And
Mm-hmm.
so we looked at a couple different types of stigma. And first, we did this in headache clinics led by Betsy Sang and Richard Lipton and myself and others in the clinic. And we found that having higher rates of stigma, experiencing this self stigma, was associated with more depression, more
Mm-hmm.
anxiety, more catastrophizing, and more disability. And then we looked at these same kinds of questions in the Overcome study, which was a mailed or an emailed survey to more than 59,000 people with migraine in the US, the largest migraine survey ever conducted.
Mm-hmm.
And we asked people how they felt others viewed them. So it's kind of an internal view of others' perceptions of you. And we ask questions, do they think that others view them as using migraine to get out of things, so a secondary
Right.
gain, or that others don't understand how painful and disabling migraine can be, kind of
Mm-hmm.
others minimize it. And we found so many results that we expected and a couple that were surprising. So certainly higher stigma was related to more disability. So more missed work, school, family, social, leisure. You wonder which way that goes. Is it because someone feels stigma that they don't engage in all those things?
Right.
Or is it that the more they have to miss, the more stigmatized they start to feel?
Right.
Also, it was associated with interictal burden. That's what people feel between attacks. How much do they worry about the next attack? How much do they change or cancel plans or not make plans in the first place because they're worried about that attack?
Mm-hmm.
So, the more interictal burden they felt, the higher stigma they felt. Again, we don't know
Right.
which one comes first or which is the chicken or the egg here, but it makes sense. And worse general quality of life was stigma. So, this all makes sense. Now, all of these things get worse with monthly headache days. So those were things we expected, but there was a finding that really surprised us. We
Okay.
expect that life gets harder with monthly headache days increasing, certainly, and that life with 25 or 30 headache days is a lot more challenging than life with 2 monthly headache days. But we actually found that no matter what the number of monthly headache days, people with stigma had worse interictal burden, worse quality of life, whether they had 30 headache days or 2 headache days, compared to someone without stigma. So
Okay.
someone with 2 headache days a month with high stigma actually globally has a worse experience with interictal burden and quality of life than someone with 30 headache days with no stigma. Someone with
Okay.
daily headache but doesn't believe it's their fault, that doesn't feel less than, that doesn't feel guilty, has a better quality of life than someone with only a couple headache days per month who carries this burden within them.
Oh, wow.
So that's a really big deal
Yeah.
because that makes me really want to work on eliminating the stigma individuals are feeling so that everything can feel a little bit more in their control, a little lighter, a little better. Quality of life can feel better, and the interictal burden, the worry between attacks can
Right.
reduce, while they hopefully also work on getting optimized treatment for them at the same time.
Hmm.
We also found that part of this puzzle, one more piece is that um, people with higher stigma were not seeking care. They were not as likely to see a doctor,
Yeah.
to get a diagnosis, and to get medical treatment. And as we know, the migraine specific medications are by prescriptions. That means you have to get to a doctor and you have to get that prescription.
Hmm.
Um, so we found that stigma is a barrier to care seeking. And maybe those two findings go together. So maybe it is that people who have more stigma aren't getting care, and therefore their quality of life in general is worse. But
Right.
it gives us two ways now we can intervene. One, we need to hit stigma head on. How can we address stigma? And
Hmm.
two, we need to get people to talk to their doctor about migraine and make sure they have optimized treatment. So now we have two action items. And I really like ways forward rather than just talking about the problem. What can we do about it?
Right. I'm glad you move forward with that because my next question, you keep answering my questions before I can ask them because you're so good at talking about this. But I want to ask you so that everyone can really end on a positive note here. What can we do with all this information? How can we improve for ourselves as women, for other women, etc.? What can we do? We've already covered talking to our doctors, realizing it's not our fault, helping other people realize it's not their fault. I think that even those of us who work in the community are prone to self-stigma, maybe not always going to our doctor as often as people might think we do. I think that if we really, really were honest with ourselves, stigma affects those of us who even work in the community. I think it's going to be a bigger and bigger topic as the years go on. So what can we do?
Well, you mentioned some of the big ones. Let's get everyone to talk to their doctor about migraine and try to get optimized treatment.
Mhm.
Being medication, non-medication, probably a combination of all those things. We need to get everyone to try the treatments that they'd like to try and see if we can get to better outcomes for them.
Mhm.
But there's also things, instead of always putting the burden on the shoulders of the person with migraine, there's things society should be doing. We need to be supporting women with infrastructure, including basic necessities, affordable childcare, affordable
Mhm.
education opportunities, affordable healthcare, the basics, affordable medication, access to medication, affordable healthy food. We need to think about accommodations in the workplace. And we do have those rights in the United States to workplace accommodations.
Mhm.
So if you haven't asked for accommodations, that's something you might want to think about. There's some great talks that Lindsay has done on accommodations. You can also look on the National Headache Foundation, American Migraine Foundation websites and think about accommodations. And there might be ways that your job can modify so that you can
Yeah.
still keep doing the job that you do. And it might be things like telecommuting, flexible or asynchronous work hours, childcare, some more flexibility in your time, in your schedule, so that if you need to close your door, and if you have a door, if you have a room, if you have a place you can go and either take a medication or get some water, lay down, close your eyes, rest, and maybe not leave work for the whole day, but part of the day. There may be accommodations at the workplace, and there also may be accommodations at school as well. And a lot of times we need to advocate for our kids with migraine. We may need to talk to the school nurse, the principal, even the superintendent. It's good to start with a medical letter from the doctor, the pediatrician, the neurologist, primary care doctor, outlining what some of the accommodations may be: a place for the child to lay down, the ability to leave the room right away to get treatment, the ability to have treatment available at school, the ability to keep water with her or him all day so they can stay hydrated, maybe the need to have an extra healthy snack break so they don't go as long without eating. So some of those accommodations at school, some of the accommodations in the workplace, supporting women with all the general infrastructure that can help women care for everybody else.
Right.
Also, on a societal level, we need disability reform, and that's something that our patient advocate groups are working towards. The Headache and Migraine Policy Forum is working on that. Dr. Bob Shapiro has been tirelessly working on that. Lindsay, I think you've participated in Headache on the Hill before.
Yes. Yes, many
There's all
times.
sorts of, yep, there's all sorts of advocacy. The other thing that we need to do, by participating in Headache in the Hill, you're supporting additional funding for migraine research. That's really important. Reducing stigma and having access to behavioral and psychological therapies and support when needed. But then the other way to reduce stigma is just education and support, like this podcast, like your work, like things that the National Headache Foundation, American Migraine Foundation do, and kind of continuing to support each other. Because as women, we take a lot on. We tend to feel quite guilty for letting anyone down. And we actually need to remember that we need to care for ourselves first so that we can care for all of those people around us.
Yes. Put your oxygen mask on first is one of the best bits of parenting advice for everyone, but especially for families with migraine, I feel like. So I'm glad you said that. Thank you so much for sharing this information with our audience. I'm so glad they got to see it, hear it. It was so amazing to be in the room when you gave this talk, and just thank you for being here, and thank everyone for watching today. Please join us again on our next episode of HeadWise. Bye-bye.